I titled this section Concussion, an evidence-based primer for chiropractors. Now, why did I call it a primer? A primer is a term usually used in reference to a textbook or a book. A primer is the first resource for the teaching of a given topic. I employ the term here to broadly refer to a lecture that presents the most basic elements of a subject. As you're aware, concussion is a very complex topic with new research emerging all the time. This section is meant to be an introduction to concussion, not a deep dive. Concussion has certainly become an important and prevalent topic, not only in the popular media, but also the research literature. This is an important condition for chiropractors to be familiar with, whether you're involved directly in the care of athletes on field or in just regular clinical practice where someone could come to you with a history of a recent or past concussion. The attention paid to concussion in the popular media has been because of major sports stars undergoing this injury, thinking of Sidney Crosby and a little bit further back Eric Lindros, for example. The prevalence in sports like American football has also shone a very bright light on this topic in the popular media. As with any clinical topic, it's inherent upon us to stay current in the scientific literature to best manage these cases. Recently, a survey study was done on chiropractors to assess their reported knowledge on the recognition of concussion injuries. The conclusions are a call to action for us, in my opinion. The researchers found that there is an overconfidence of the chiropractic practitioner in the recognition of mild traumatic brain injury or concussion, which is incongruent with the low knowledge scores. Further education of the chiropractic clinician is certainly warranted in this topic, and that's why we're here today. It is important to start by reviewing how we define a concussion. The good news is there's relative agreement on this in the scientific literature. Concussion is defined as a traumatic, transient disturbance of brain function that involves a complex pathophysiological process. Concussion is considered a subset of mild traumatic brain injury, or MTBI, and a condition whose symptoms cannot be explained by drugs, alcohol, medication use, or other injuries. Further, sport-related concussion is a traumatic brain injury induced by biomechanical forces, with several common features that help define its nature. Further, concussion is a functional rather than structural injury, as there's always or almost always normal neuroimaging. As I've done before, it's always interesting to find out what our patients are reading about concussion via Dr. Google. A quick Google search will reveal the following definitions. Concussion is a traumatic brain injury that affects your brain function. That sounds scary, doesn't it? Effects are usually temporary but can include headaches and problems with concentration, memory, balance, and coordination. Further, concussion is usually caused by a blow to the head. Violently shaking the head and upper body also can cause concussions. Some concussions cause you to lose consciousness, but most do not. We'll talk more about that in a moment. It's possible to have a concussion and not realize it. Concussions are particularly common if you play a contact sport such as football. Most people usually recover fully after a concussion. All of this is readily available on the Mayo Clinic website with a quick Google search. As with many other conditions, it's becoming clear that Google can educate our patients in a beneficial way. So what are the defining features of a sport-related concussion? And that will be our focus for this program. First, sport-related concussion may be caused by a direct blow to the head, face, neck, or elsewhere, with, importantly, an impulsive force transmitted to the head. It is important to note that direct contact with the head is not necessary. Second, sport-related concussion typically results in a rapid onset of short-lived impairment in neurological function that resolves spontaneously. However, in some cases, signs and symptoms may evolve over minutes to hours. Third, sport-related concussion may result in neuropathological changes, but the acute symptoms represent a functional disturbance versus a structural injury. This is why we don't see any abnormalities on neuroimaging. Fourth, there are a range of possible clinical symptoms which may or may not include a loss of consciousness. Fifth, resolution of a sport-related concussion typically follows a sequential and almost predictable course, but may be prolonged in some cases, and we'll talk about that later on. Finally, sport-related concussion clinical presentation cannot be explained by drug, alcohol, or medication use, or other injuries or comorbidities. So what happens when you hit your head or get a concussion from contact to some other part of your body? Our understanding of the neurometabolic cascade involved in concussion pathophysiology has certainly expanded and become more clear over the years, but we still have some holes to fill in our understanding. The neurometabolic cascade generally goes something like this. First, there's obviously an impact, whether it's to the head or your upper torso region, directing the force to the brain. We used to think that a concussion involved basically smushing your brain back and forth within your skull. That doesn't necessarily reflect our current scientific understanding. Rather, the primary pathophysiology of a concussive impact is a neuronal shearing primarily at the brainstem level. This causes a burst of excitation, an ion imbalance within the brain, and a release of excitatory neurotransmitters. This excitatory stimulus is often overwhelming for your brain, which results in a loss of consciousness. That's your brain's reaction to this sort of stimulus. Subsequent to that, glucose utilization increases, there's a general reduction in cerebral blood flow, and this results in an energy mismatch. This can lead to a buildup of reactive oxygen species or generalized neuronal inflammation, which long-term could potentially lead to axonal degeneration. As I said, from a research perspective, we're still putting some of the pieces together in this neurometabolic cascade. So what sports most commonly cause concussion? I think some on this list are relatively obvious, starting with American football. Here, men are paid high amounts of money to use their heads and helmets as weapons to hit other players, so no surprise that there's a high degree of concussion there. You see soccer, both boys and girls, on this list as well, and most of the incidents of concussive injuries come from two players going up to head the ball at the same time. There's also some data showing that the act of heading the ball itself can, in some players, particularly women, represent a cumulative concussive trauma over the course of a season. That's some alarming data that the soccer world may have to deal with at some point. Other sports on this list that might be obvious are hockey, of course, but also things like lacrosse and basketball. This often involves players randomly hitting each other or having it be part of the play during the sport. So what do we know about risk factors for concussion? The literature in this area is a little bit all over the place, but we do have some systematically reviewed data to go on. There are only two factors that have a high certainty, meaning if these factors are present, it can predispose someone for a future concussion. Those are having had a prior concussion and being involved in gameplay versus practice. There's data to show us that players typically don't get concussed during practice, which makes sense because you're not going to tattoo your teammate into the boards just to prove a point in a drill. Most concussive injuries in contact sports happen during the actual competition itself. Those risk factors with low certainty include a mixed bag of things, including the following. Gender. Women are a little more predisposed to concussion than men. We're not exactly sure why. Age. Mechanism of injury, and that means did the player hit another player or did their head or body collide with a surface, for example. The level of competition, player position, protective equipment, genetics, the presence or absence of body checking, and that's a topic specifically related to youth hockey, and other factors like general fitness, anthropometry, which means the general size and shape of an athlete, what weather conditions occur, and so on. It's within reason that if you're playing football in Minnesota on a grass surface in January, that ground is going to be a little bit harder than a softer turf in Tampa Bay in July. So these factors can all influence the incidence of concussion or someone's individual risk for a concussion. There has been a lot of talk over the years about how to prevent concussions. So what does the literature tell us about this? There are a couple of systematic reviews we'll cover here. The first one included 48 studies. What it found was that helmets and headgear can reduce impact force, but don't reduce concussion incidence, and this data comes to us mainly from hockey and football. Second, helmets are protective in skiing and snowboarding and cycling and equestrian. Why do you think that might be? I think it's because these are all individual sports. If you think of hockey and football, you don't always know that you're going to be hit by one of your opponents. You don't always see the impact coming. But in single sports, you can often prepare your body. You know you're going to crash on a wave or crash while you're skiing. Or on a horse, you know I'm going down and I'm going to fall over. So that might be why the literature shows that helmets are a little more protective in those instances. Further, eliminating body checking, as I mentioned in youth hockey, has been shown to be effective, and this has the strongest evidence. Personally, I'm a little conflicted on this issue because I think you have to teach young hockey players how to engage in physical contact but do it safely. I also think a reasonable issue to discuss here is the variability in size of 12 and 13-year-olds, for example. Some 13-year-old boys are a foot taller than I am and weigh the same as I do. Some of them are half my size. Perhaps those two individuals shouldn't be playing against each other, and we've never really approached youth sport in that way. Lastly, from this systematic review, the evidence is generally mixed regarding mouth guards. What we know is that they can reduce dental injury, and that makes good sense, and are likely protective for sport-related concussion, but we do need more evidence in this area. The second systematic review included 14 prospective studies. It came to similar conclusions as the paper we just covered and revealed that there's no difference between standard and novel or new protective equipment. Regarding future directions, we have to look at ongoing studies regarding the influence of neck strength on concussion risk, vision training, cerebral venous engorgement, and some other factors that may influence someone's susceptibility to this sort of injury. Generally speaking, there's a lack of prospective randomized trials on preventive measures and preventive equipment, and generally low quality research in this area as a whole.